Hey there, guys. Let's talk about something that might be a bit uncomfortable, but it's super important. Erectile dysfunction, or ED. Now, can you test for ED at home? Well, kind of, but not really. Let me explain. Firstly, recognizing the signs of ED is crucial. If you're having trouble getting or maintaining an erection on most occasions of sexual activity, that's a big red flag. Other signs can include low self-esteem, depression, anxiety, stress, and even relationship difficulties. And trust me, you're not alone in this. It happens to many men out there. Certain health conditions can also cause ED, like high blood pressure, diabetes, heart disease, high cholesterol, and obesity. If you're physically inactive or a smoker, your chances are even higher. So what about testing for ED at home? In the past, people tried various self-testing methods, but these aren't recommended by doctors due to their inaccuracy. One of those old-school methods was the nocturnal penile tumescence, or NPT test. This involves sticking a roll of stamps around your penile shaft overnight. If the stamps were broken by morning, it indicated you had an erection during sleep. Sounds odd, right? Chuckle. But it doesn't really tell you much about your ED status. Medical professionals have discounted the NPT test because it's just not reliable. Now, there is a more accurate self-assessment tool called the Sexual Health Inventory for Men, or SHIM. This is a questionnaire that can provide a good initial indication of whether you might have ED. You can do it at home, but it's better to have a doctor interpret the results. For a proper diagnosis, though, you'll need to see a doctor. They'll assess your medical history and might order blood and urine tests to check for underlying conditions like heart disease. Sometimes ED is caused by emotional or psychological factors. In these cases, you might still be able to have an erection, but still struggle with ED. A doctor might ask about your mental health or stress levels, and could suggest psychotherapy or medications such as antidepressants. So to sum it all up, many men experience ED, and it's not something to be ashamed of. It's a common issue, and doctors often find it challenging to pinpoint the exact cause. While the NPT stamp test was an old method to check for ED, it's been thrown out because it's far too inaccurate. Instead, consider using the SHIM questionnaire as an initial self-assessment. But remember, for an accurate diagnosis and effective treatment, talking to a doctor is the best course of action. If you're concerned about ED, don't hesitate to reach out to a healthcare provider. You're not alone, and there are treatments available that can help. Thanks for watching, and take care of yourself.